Hello everyone, myself Dr. Santosh Sahu from TGH Onco-Life Cancer Center, Pune. In a series of podcasts, today we have Dr. Jyoti Mehta ma'am, consultant clinical oncologist. She has 6 year plus rich experience in radiation oncology as well as in medical oncology field. We'll start our podcast session on one of the most common cancer in women, breast cancer. Can you please tell us about signs and symptoms of breast cancer, ma'am?
Hello, Dr. Santosh Sahu. Thank you for having me here today. As you rightly said, breast cancer is one of the most common cancer among females, and because the cases are increasing day by day. So when we talk about statistics, every 1 in 25 women will have cancer, breast cancer in future, and this is in India. And when we talk about worldwide, every one in 8 women will have breast cancer in future in America. So cases, when you compare America, India, cases are quite less, but cancer causing mortality, cancer causing deaths are more in India as compared to world data. So the signs and symptoms, the most common symptom what we see in our OPD is a lump in the breast. A female come with the lump in breast. So, but not all the lumps are not necessary they are cancerous. So what are the other signs and symptoms you will have to look for? That is, if there is any redness on the breast or associated with tenderness, pain, or blood discharge from the nipple or any other discharge from the nipple, or is there any change, sudden change in the shape of breast. So all these signs and symptoms we will have to look for to see whether it can be breast cancer or not.
So, ma'am, if a patient comes with a breast lump, what next? How you guide further?
So, if the patient comes with breast lump, first we need is detailed history. If a patient is having any family history of breast cancer, if the patient is young or elderly patient, if there is any past history of breast cancer. So, all after detailed history of the patient, then we further do sonography or mammography depending on the age. If the patient's age is more than 40, we ask the patient to do bilateral breast mammography. So in this we will get to know whether this lump is can be malignant or not. So after doing mammography, if we talk about in terms of grading. So if Birad's grading, so if Birad's grading is 3, 4, 5 depending on the shape of lump or all these factors, so we ask the patient to get a biopsy done. So true cut biopsy, what we sometimes patient, that lump is not palpable, but it need not be, this is not a cancer. So we ask the patient to get sonographic guided biopsy done.
So, ma'am, we heard about Hollywood actress Angelina Jolie who had undergone a prophylactic mastectomy based on a genetic test. So what does genetic has a role in breast cancer, ma'am?
So there are the risk factors of breast cancer are majorly divided into 3 risk factors. One is hereditary, that is family related, hormonal or environmental. So 5 to 10% of the patients with hereditary breast cancer will have some kind of genetic mutation. BRCA1 and 2 are the most common mutation found in hereditary breast cancer. So, Angelina Jolie, she was diagnosed with a familial breast cancer. She had a family history of breast cancer, and BRCA1 mutation was positive in her family. So, that is why, because these mutations carry a high risk of developing cancer in the future. So, that is why she chose to undergo bilateral prophylactic mastectomy.
Ma'am, nowadays we are hearing most of our television actors also are diagnosed with breast cancer. To name a few, Miss Hina Khan, she's fighting very bravely and creating a very good awareness among for breast cancer. Is lifestyle also may impact the the prevalence or incidence of breast cancer, ma'am?
Yes, definitely. When we just talked about various risk factors. So environmental are one of the risk factor in breast cancer. In that, mainly the lifestyle, sedentary lifestyle. So work stress. So sedentary lifestyle means lack of exercise, unhealthy lifestyle, like eating unhealthy diet. All these are the factors could can cause cancer in the future. So and other a lot of pollution, other risk factors. There are many carcinogens we are using nowadays, microwave. Then other risk factors are as we discussed is hormonal. So there is a lot of hormonal imbalance in the females. So early menarche, late menopause, no child at all, not getting married at a adequate time, not having children, not having breastfeeding at all, or so all these are the risk factors for breast cancer. So yeah, sedentary lifestyle is a very common risk factor for the breast cancer. Lack of exercise, unhealthy lifestyle, unhealthy diet, intake of alcohol, smoking, all these lifestyle bad habits are a risk factor for breast cancer. And other than that, we have hormonal disturbance now in females with early menarche, late menopause, or not marrying at all, not getting children, not feeding babies. So these are the risk factors. So although the breastfeeding is a preventive factor for breast cancer, so that we should encourage females to have adequate breastfeeding for their children. So that is how we can prevent breast cancer. So awareness is the key.
So, ma'am, I have read somewhere physical outfit also will have some impact on incident breast cancer. Wearing what kind of dresses you wear.
No, that is totally a myth. That does not have any impact on breast cancer. There are a lot of things are going in market. Tight clothes can cause breast cancer. No, that is not there. So major risk factors for the breast cancer is, as I told, is hormonal, environmental, or hereditary. These are the three major risk factors for the breast cancer.
Can you elaborate more on the treatment part after diagnosed breast cancer? Then what next? The surgery, radiation.
So, the treatment per se for the breast cancer depends on the staging of breast cancer. So, the breast cancer is divided into early breast cancer, locally advanced breast cancer, and metastatic breast cancer. So, early breast cancer, we can ask the patient to undergo surgery directly. So after that, depending on the histopathology report, we can advise the patient whether further treatment is required or not. In locally advanced breast cancer, which means the size of tumor is around more than 5 centimeter, which has a tendency to spread to the lymph nodes. So most because the lymph nodes in axilla are near to the breast tissue, so the most common spread to the spreads to the axillary lymph nodes. So then that makes a locally advanced breast cancer. In those cases, first as per the guidelines, patient should undergo chemotherapy, should receive chemotherapy, certain cycles of chemotherapy. Then after the response assessment, we can ask for the surgical intervention. And also depending on the histopathology, patient may require radiation further.
Ma'am, what about the technology front? What are technology that what we have we can?
So yeah, so the new advances, if you talk about in science, in cancer, we have come quite far away. So in surgery now we have breast conservation surgery. So earlier time mastectomy was the only option. So now we have breast conservation surgery. We call it BCS. So with this and sentinel biopsy. So what is sentinel biopsy usually? So give a dye and see if that node is picking up the dye, and you remove that dye, and that is called sentinel biopsy. And breast conservation, you just have to remove that lump with certain margins. You need not to remove the entire breast. So because we have further adjuvant treatment, advanced treatments for the radiation, like we have in TGH Onco-Life Cancer Center, we have tomotherapy with synchrony. So the advancement, and we have DIBH, we have all these the advanced therapies, to see whether later on, if breast conservation surgery is done, so we can give adjuvant radiation.
And one last question: can men have a breast cancer?
Yeah, yes. Although cases are less, I mean, only 1% men are diagnosed with breast cancer. And hereditary cancer are not only females are affected, men can also be affected. So the mutation what we talk about, BRCA1 and 2 mutation, that can also inherit in the men. So men can have prostate cancer, male breast cancer. So male breast cancer is only 1%. Prostate cancer. Then other cancers also can be diagnosed in hereditary breast cancer.
And what's the role of hormonal or targeted therapy in breast cancer, ma'am?
So yeah, depending on the IHC, that is immunohistochemistry, so we can see whether these tumors are ER, PR, HER2 positive or negative. So suppose if ER, PR positive, so we call it hormone positive cancers, right? In those cases, patient after completing the treatment, patient will have to take hormonal therapy for 5 to 10 years depending on the risk. And suppose if HER2 positive means this target is positive in the breast, so that can be targeted with targeted therapy. So nowadays this is a huge advancement in oncology field. So trastuzumab is one targeted therapy we can give in HER2 positive patients. So that gives a very good, the overall survival benefit, also the disease free survival benefit in breast cancer patients. And when we talk about triple negative, means ER, PR, HER2 negative cancers, in those cases there is no hormone to give hormonal therapy, there is no target to give targeted therapy. In those cases, immunotherapy plays a very good role. Immunotherapy like pembrolizumab, so this gives a good response in such kind of patients. So we can keep the patient on maintenance immunotherapy later on.
What are do's and don'ts after treatment? What patient should be very cautious, and how the lifestyle should be?
Yes, so the important thing first a patient should do is follow ups. So regular follow ups are very much important. So every 3 months they should visit, meet a doctor, and when they advise a doctor advise mammography, they should do it. So why follow ups? Because if suppose a patient is of left or right breast, to see whether the other breast is healthy or not, if patient is having any lump or any changes in the other breast, so physical examination is important. So mammography in screening for the other breast is important. Okay, so the regular follow-ups is important for the patient. What not? So obviously if patient is smoking earlier, so should not continue smoking, should stop smoking. Healthy lifestyle, exercise 3 times in a week or 3 to 5 times in a week depending, and then eat healthy diet, eat less of this fast food, pizza, burgers, can avoid this fast food.
vape has any effect on breast cancer? Since you mentioned smoking.
So, yeah, well, that is a gray zone. Certain studies are going on to prove whether vape can cause cancer or not. So, we yet to see the results, but definitely vape is not advisable to have it because it can cause throat irritation, the other harmful effects can have it. So, as a healthcare professional, I would not advise to continue vaping, and yes, definitely a patient who's having, I would advise you to quit.
Thank you, ma'am, for such an insightful session. Any concluding remark or recommendation, ma'am?
So to conclude, women should have enough awareness about breast cancer. As per the recommendation, they should undergo a regular screening. A female who is more than 40 years or year old should undergo regular annual mammography, and younger females who have a high risk factors, like who has a family risk or any BRCA1 2 mutation in the family, they should undergo early breast screening. At the age of around 30 years. So in those patients should avoid doing mammography. They should do sonography as well as MRI for the breast screening. You need not to worry. All the cancers are not a death sentence. However, the early breast cancers, if you diagnose at an early stage, the prognosis is better.
So, guys, thank you all for joining us. Thank you, Dr. Jyoti ma'am, for this insightful session. We at TGH Onco-Life Cancer Center Pune have a very robust cancer program. We have all services under one roof, and if any queries, you please reach out to us. We'll be happy to help you. Thank you.
Thank you everyone for listening us, and thank you Dr. Santosh Sahu for such wonderful discussion. Thank you.